Now, if a trainee can complete a 3-month on-the-job training, he'll be given $3,000 as an incentive, and then if he stays on, there will be an extra $1,000 per month. In the past, the allowances were given to employees, but those I just mentioned are for the employees, and so for the retaining allowance, a trainee can receive up to $12,000. For maternity leave, we hope that by early next year we can extend the maternity, we can submit the legislation to extend the statutory maternity leave from 10 weeks to 14 weeks early next year. Assuming that the law can be passed by the Council in the middle of next year, we hope that by the end of next year, we'll be able to subsidize or provide the extra 4 weeks of maternity pay to employers for the sake of employees. And as for MECAP, Minor Employment Claims Adjudication Board, we have proposed to the Council that the jurisdictional limit should be adjusted upwards. That has the approval of the Council. So we would like to increase the limit from the current $8,000 so that we can expedite the handling of wages disputes. And as for foreign domestic helpers, we would like to set up a dedicated FDH division. We have over 390,000 foreign domestic workers in Hong Kong. Very soon they will pass the 0.4 million mark. We will step up publicity and education, and we will disseminate information in relation to improvement in policies and support services to FDH through this new division. The C's policy address mentioned rehabilitation services. In last year's policy address, we announced a relevant study, and the work is almost complete. We propose to launch a 3-year pilot rehabilitation program for construction workers. The reason being that this sector has a higher serious accident rate. So we will first focus on the construction sector. We will try to cover workers that are more seriously injured. We hope that with access to private sector rehabilitation services, they can rejoin the workforce sooner. To do that, we have to amend the legislation. We are going to commission the Occupational Safety and Health Council to administer the program for us. We will empower OSHC to do the job for us, and after 3 years, we will review the outcome and consider the long-term financial and operational arrangements. We'll continue to step up our efforts on protection of occupational health and safety, because while we have seen a declining rate for industrial accident rates, however, the death rate is still at a rather undesirable level. Although we've seen ups and downs for the rate, so we will promote occupational safety by means of ambassador scheme, so that we can enhance the statutory reporting mechanism. Now I have reached the last couple of slides. The business sector is very concerned about the offsetting arrangement under the MPF scheme. We are ironing out the details because the offsetting arrangement has been implemented for a few decades, and many policy areas are involved. So we hope to complete the study by the end of this year, and we can start to draft the legislation for introduction to the Council come next year when a new term starts. We hope that the arrangement can be put in place in 2 years' time or after the abolition of the centralized or implementation of the centralized platform of EMPF under the MPF scheme. Now it is the Secretary for Food and Health's turn. Good morning, members of the press. I'd like to review on what our Bureau is going to do in the area of improving people's livelihood. We are tasked to protect public health and to enhance public health. We have a series of policies and measures and services to achieve our aims. First, on food, we attach a lot of significance to food safety, environmental hygiene, and farming and fishery policies. The major initiatives covering food are covering health. Because of the global and local population aging trend, we have to keep up with the times, and then we have to review our healthcare system from time to time and reform our policies, hoping to provide quality, affordable, and sustainable services to the public. There are 6 main areas. This is the first, and that is primary health care. Under primary health care, it is important to promote primary health care and to enhance prevention and control of diseases. And then we need to promote the development of Chinese medicine and to enhance our public health care services, including many services being provided by the hospital authority.
Number 5, we have to make sure that our healthcare system is sustainable. And number 6, we need to perfect public health control and policies. First, primary health care. We hope to reverse treatment-oriented care. Since we have overlooked prevention, we are determined to set up district health centers in all 18 districts. Originally, we only treat the ill, but in the community, people may not be sick, they may be at high risk, but they are not sick. So we have to work more at the upstream. The DHC branches from that concept. We are going to have district-based medical social collaboration. The first one was commissioned in Chi-kwong at the end of September. 講咗咧係我哋喺其他嘅17區咧
The
都會係
PA
有一啲嘅
states
喺現屆政府內咧都會有一啲嘅安排嘅。
There will be arrangements
主
made
要
for the
咧
other
就係
17
喺
districts
其
within
餘
this
除咗
term
葵青
of
之外咧，有
government.
6個區，我哋咧係會做我哋嘅地區康健中心啦，就
We
會
will
係
set
將
up
呢個工作咧係會開
DHCs
展。
in
咁喺
6
現
other
屆政府之內咧
districts.
已經係
The
會
work
開
will
展㗎，已
start
經係會
within
開
this
㗎。
term
咁
of
而其餘
government.
嘅11個區咧係亦都係會有一啲咧係差唔多係屬於過渡性嘅一
There
啲
will
地
be
區康健站。
transitional
咁呢啲地區康健站
DHC
當然個規模咧係
express
比較細啲，
at the
但係
other
我哋咧係
11
希望咧喺
districts.
現屆
They
政
are
府
They're of a
之
smaller
內咧
scale,
係能夠喺18區咧都做
but within
晒
this
咧
term of
係每
government,
一個
we hope
區
to
都
set
有
up
呢一啲嘅以預防為主，同埋咧係希望咧除咗係可以
prevention-based
係提升市民
care
健康之外咧，
facilities.
亦都咧係會有
They
好
will
多唔同
be
嘅服務咧
able to
係
enhance
去
the health
令
of
到
the
咧
public.
市民咧可
They
以
will
提
also
升佢自
provide
己嘅健康管理嘅能力嘅，即係除咗
services
佢
to
係話
enhance the
提高
public's
佢嘅意識，
ability
但係自己對自己
to
管理健康能力
keep
咧，呢個
themselves
都係
more
一個好重
healthy.
要
In
嘅
other
一
words,
個
they will be
課
able
題
to
咧。
have better
其實呢啲地區
capacity
康健
to
站同埋地
manage
區康健
their
中
own
心咧
health.
係要做嘅工作。咁所以咧呢一啲嘅地區康健站咧，亦都會喺日後咧係
In
過渡
future,
至
the
當區嘅地區
DHC
康健中
Express
心。
will
咁即係話咧，
migrate
其實每一區咧
to
都會有
become
地區康健中心大型嘅，
DHCs.
但係咧就喺
There will be
嚟
a
緊呢
DHC
2年幾咧，我哋就
in
會
every
係
district, but in the
做
coming
好
2 years
我
or
哋嘅
so,
地區康健中心同埋地區康健站。長遠
we
嚟
will
講
be
咧，我哋
building
係希望咧
DHCs
喺
and
每一區
DHC
咧都會有一個
Express.
政府嘅
In the
選
long
址咧
term,
係
there
做
will
呢
be a
啲地區康
government
健中
site
心。
for setting up
亦都係我哋醫療
DHCs.
系統嘅一個重要一個部分。咁所以咧就唔
It will
係話
become an
一個
important
計
part
劃
of our
啊，或者
healthcare
係
system.
即係淨係咧係做一個區一個區咁，而係咧係完全咧係將來咧我哋係會整合咧變成
In
我
the
哋咧
future,
醫療系統重要一部分。咁而
this
家
will
咧我哋
become
係
an
有一個
important part of our
督導
healthcare
委員會
system.
咧一路睇
A
住，我
steering
哋都將會
committee
咧係
is watching
設
over
立
the
咧
project.
會發布呢一個咧對於香港發展基層醫療健康嘅一個藍圖嘅嚇。
They will map out a
咁
blueprint for
除
developing
咗
primary
呢
health
個
in
之
Hong
除咗
Kong.
呢個之外咧，OK 睇一睇，好似唔係好 work 喎。OK 好得嚇，咁就跟住講一講咧其他嘅一啲嘅範疇啦嚇。咁包括係
Other
疾病
areas
防控
now.
啦，疾病防控咧其實係非常之
Prevention
重
and
要，
control
我哋
of
都係要
diseases.
睇一睇我哋預防。
This is
咁今次
extremely
咧，我哋
important.
就講集中一啲新嘅措施。咁所
We'll
以咧，呢個疫苗
concentrate
接種
on
計劃，咁
new
大家都
measures.
知道啦，
First,
每年都有流
vaccination.
感高峰期嘅，
We
咁小
have
朋友咧嘅疫苗接種係
peak
非常重
flu
要。
periods
咁所以
every
咧，我
year,
哋咧
and we
係
have
喺
to
舊
look
年咧
after
做
our
咗我哋
children.
嘅小學嘅一個
Last
外
year,
展嘅服務，咁今年咧就
we
會恆常化啦，同埋亦
have
都係
the
擴展到
school
咧
outreach
係幼稚
program.
園同
This
埋幼兒
year,
中
it will
心
be
嚇。
regularized, and it
咁
will
除咗
also
咁咧之外咧，亦
cater
都
to
係
kindergartens
有
and
一啲嘅
childcare
學校咧
centers.
係亦都會係試行咧係一啲噴鼻
Some
式
schools
嘅
will try out
流感疫
nasal
苗
live
咁呢個咧就喺
attenuated
小朋友嗰
influenza
度咧
vaccines,
睇一睇嗰個
which is
成
like
效
a
係點
nasal spray.
咁第二咧就
And
亦
we'll
都
gauge
係
the
為懷孕
results.
嘅婦女咧喺每一次懷孕嘅時候咧係接種一
And
劑
every time
嘅
a woman gets
無
pregnant,
細胞型嘅
she will
百日
get
咳嘅疫
one
苗，因為
dose
咧
of
我哋
a
發現咧
cellular
百日咳咧
pertussis containing
上升嘅趨勢，
vaccine.
咁所以
We
我
have
哋去
seen
保
the
護
increase of incidence of this
懷孕
disease,
嘅婦女同埋咧最重
and
要係
we
佢生出嚟小
therefore
朋
would
友
like
咧，
to
其實咧就都會
protect
有
the
呢一
pregnant
個嘅
woman
服務嘅。
and her
咁
fetus.
跟住咧就係對病毒性肝炎啦。咁其
Next,
實咧
viral
病毒性肝炎咧
hepatitis.
呢一樣嘢咧都係一個非常之重要嘅公共衛生嘅問題。咁
This
所
is
以我哋
a
根據
serious
世界衛
public
生組
health
織嘅建
issue.
議咧，
In
同埋
line
國際
with
間嘅做法咧，
proposals
其
of
實
the
而家
Public
咧
Health
我哋將會
Organization
係
and
喺
international
2020年
practices,
咧係訂立一個行動
we are
計
going
劃。
to
咁而
formulate an
呢個
action
行動
plan
計
in
劃咧，亦都係
2020
希望咧佢可以減輕咧
in
呢個
order
病毒
to
性肝炎咧對我
reduce
哋
the public
自己
health
嘅
burden posed by viral
醫療體系
hepatitis.
咧帶嚟，同埋咧對公共衛生帶嚟嘅一個負擔。咁中醫藥啦，中醫藥咧係
Chinese
我哋
medicine.
一路咧係做咗好多唔同嘅功夫，除咗咧係
We
我哋
have
一路
worked
係有
on
我哋
different
中醫藥
aspects.
發展委員會啦，喺食物及衛生局底下咧一
Under
路
the
去
Bureau,
睇翻佢
we
嘅發
have
展
the
咧。我
Development
哋
Committee,
有幾個具體嘅措施咧，
and now we have
喺
some specific measures. These were included in the last PA, and now I'd like to report to you the progress. First, we have incorporated Chinese medicine into our healthcare system. And there will be three major initiatives. One, the first Chinese medicine hospital will be set up in Chi-kwong. The progress is excellent. We are now having the pre-qualification tender stage, and we are going to identify a contractor by 2020. Of course, that will be subject to a proper tender process. And we expect to commence operation in phases by the end of 2024. Two, outpatient clinics. We already have 18 of these. In the first quarter of 2020, we are going to increase the service level. Every year, there will be 600,000 places annually which will receive subsidy. These will include outpatient, Tuina, and acupuncture services. These will be subject to the standard fee of $120. And number three, integrated Chinese with Western medicine inpatient services. In 7 hospitals of the HA, we already have such collaborated service. And also, from the first quarter of 2020, we'll reduce the fee from $200 to $120 per day. Of course, it depends on our assessment to see whether we need to expand the service, gaining the experience in these 7 hospitals. We also have a 500 million Chinese Medicine Development Fund, which was launched in June this year. We have received various applications for service provision, and very soon we'll be launching some programs. Hopefully, we can disperse funds in the 4th quarter. This may include training, research, or service provision programs, and also the subsidizing the development of Chinese medicine. At the development of health, we are going to set up a permanent government Chinese medicine testing institute. It will be sited in Chi-kwong. This will be next to the Chinese Medicine Hospital.
Just next to the Chinese Medicine Hospital, there will be a government Chinese Medicine Testing Institute. And then we've also announced our Hong Kong cancer strategy, from prevention to screening to monitoring and treatment, and also to enhance the quality of cancer recovery patients. Now we have a few new measures. First, we will develop an online resource hub for the public to use. It will serve as a one-stop resource center so that they can have access to all health and cancer-related information. The HA, of course, has an important role to play in diagnosis and treatment, so they will have new services covering diagnosis and cancer management, so on and so forth. They will have pilot streamlined cancer-specific diagnosis services. They will extend the cancer case management program. These will help to improve our cancer case management, and one-stop service can then be provided. They will also introduce advanced medical technology for cancer treatment, covering both diagnosis and treatment.
咁最後咧就藥物啦，咁亦都係擴大醫管局嘅藥物名冊入邊嘅癌症
And
藥物嘅
we're going to expand the coverage
咁當然
of
咧
cancer
除
drugs
咗呢
in
啲嘅治
the
療
drug
之外咧，
formulary.
康復都係非常之重要，因為我哋
Rehabilitation
人
is
口
just
老
as
化咧，
important
亦
as
都有好
treatment
多
because we have an aging population and because of advancement in medical technology.
其實個存活嘅時間咧係好長，
And
咁所以咧我哋亦都
patients that are recovered from cancer can live for a long time afterwards. So we have measures to enhance the support
令到佢哋係得到除咗係
for
適時之外咧，都係有更加對
such
佢哋嘅生活
patients
質素
so that we
係好啲嘅
can
咧，就
ensure
會
timely provision of support and care to cancer
不常見疾
survivors.
病咧，亦都我
Uncommon
哋非常之
disorders
關注嚇。雖然個數目唔係
is
好
also
多，
a
但係咧
subject
我哋
very
都覺
close
得
to
咧
our
係
heart,
對
while
佢哋嘅資
the
源咧應
number
該係
of
增加。
such
咁所以咧，我哋亦
patients
都
is
研
not
究咧
high,
係
but we feel the
就
need
住
to
唔同嘅
enhance
不常見嘅疾病
the
咧
support
係
to
建立
such
一個資
patients.
料
So
庫
we
啦。咁呢個亦
propose
都
to
會令
set
到
up
我
a
哋嚟緊
database
提供
for
嘅治療啊、
uncommon
研究啊
disorders
係會做得更加好嘅。
to
咁亦
help
都提供
our
公眾
future
對不常
research
見
and
疾病嘅
treatment,
認知
and
啦，
that will
同
help
埋
to
咧係加強
enhance
咧去
public
支援
awareness
佢哋
of
呢
uncommon
啲不常
disorders,
見嘅
and we
病
will
人啦，同埋一啲
enhance
癌症病
support
人嘅藥物治療。
the
咁
drug
最後
treatment
咧
for
就展
patients
示
with
翻人手
uncommon
嘅配
disorders
套同
and
埋咧係投
cancers.
放資源咧
And we
係
will
去
review
協助呢啲
manpower
照顧者
support and
佢
deploy
哋嘅需要。
resources
咁
to
當然
help
研
meet
究
the
都係
needs
非
of
常之重要嘅
patients
嚇，
and
科
their
研。咁我
carers.
哋對於不常見呢啲疾病嘅科研咧
Of
嘅
course, R&D
同
is
埋臨
very
床嘅研究
important.
咧，亦都係希望咧喺呢度咧係可以咧係再做得係更加
We
好。
want to enhance
咁基因
our
組醫學啦，基因
R&D
組醫學咧其
efforts.
實喺世
Now,
界咧都係一個
genomic
大趨勢，
medicine,
無論
this
咧
is already a
係
global
喺
trend.
去加強嗰個治療嚇或者係加強診斷
Would
咧，
it
都係
be
有一個非常之重要嘅角
enhancing
色嘅。咁所以
an
政府咧，我哋
enhancement
喺上一
in
個施政報告已經
diagnosis
講咗
and
咧，我
treatment?
哋會
Genomic
係
medicine
成
is
立
very
一個
important.
基
The
因組
policy
嘅中
address
心
announced
去
that
推
a
進我哋嘅
genomic
提升嘅研
institute,
究。咁
a
而呢個
genome
基因組醫
institute
學
will
督
be
導
set
委
up,
員會咧，
and
亦
the
都會
Steering
喺本
Committee
年
on
底咧係
Genomic
就住整
Medicine
個嘅計劃咧
plans to
係向
submit
政
its
府咧
report
係
to
提
the
交報告。
government
咁同
by
埋
the
咧
end
呢
of
個中
this
心
year.
咧而家咧又喺籌備當中，都係
The
運作緊嘅。
institute
咁亦
is
都會
now
喺2020年咧
being
係會
planned,
成立，咁係
and
推行
it's
咧我哋
expected to be
香
set
港
up
呢個基因
in
組嘅。
2020 to
咁
take forward the
晚
Hong
期
Kong
照顧
Genome
同埋咧係
Project.
智慧醫院同埋大
And
數
of
據應用咧，
life
亦
care
都係好重要。
services,
因
smart
為晚期
hospital,
照
and the
顧服
use
務
of big
我呢
data
度
are
唔多
also
講啦，大家知
important.
我哋較早前咧都
Earlier
係
on,
有一
we
個嘅立法嘅建議，咁喺而家咧係
launched
做緊
a
諮詢，
public
咁就會
consultation
喺
on
12月
legislative
咧係會結
proposals
束嘅諮詢。咁
on
然之後
the
咧，我哋都會
subject.
分析
It is
諮詢
now
翻嚟嘅意見啦嚇，
the
同埋咧係一路咧係推展我哋立
consultation
法嘅
is still
建
in
議。
progress,
咁智慧醫
and
院
it
同
will
埋
be
大數
completed
據
in
嘅應用
December.
咧，其實大家知道咧，我
For
哋
smart
即係
hospital and
創
the
新
use
科
of
技
big
咧，都會
data,
係
as we all
能夠對
know,
我哋嘅成個醫療體
innovation
系
and
咧帶嚟咧
technology
有好
will
多
see
而家現有嘅服務嘅提升。咁所以醫
how
管局咧亦都會研究咧
existing
智慧醫院
services
嘅
can
措
be
施咧，
enhanced.
希望咧喺
The
一啲病
HA
人嘅
will
服務例
study
如流程啊、
smart
管理
hospital
啊等等方面
initiatives,
咧係
hoping
更加好、更加暢
to
順。咁至於
improve
大
its
數據嘅分析
workflow
咧，
and
醫管局都設
management
立咗一個大數據分
of
析
the
嘅
patient's
平
journey.
台，係一
And
個實驗室。
HA will
咁啊，
formally
加強咧
launch the
係
big
喺
data
大數據分
analytics
析方面
platform
咧嘅研究，同埋咧
to
係
enhance
唔
its
同嘅同大學嘅一啲嘅合
research
作
of
嘅。
big data
咁強
and
化醫療服務亦
cooperation
都
with
會加強精
universities.
神健康啦嚇，精神健康服
We
務
will
非
also
常之
strengthen
重要。
our
咁有幾
medical,
項
our
咧
mental health
特別
services.
講一講，除咗咧，我哋而家喺食物及衛生局有個精神
Under
健
my
康嘅諮詢
bureau,
委員
we
會咧，
have
係研
an
究點樣
advisory
去更
committee
加
on
有效
mental
去
health
強化我哋
to
兒
see
童
how
同
we
埋青
can
少
more
年嘅健康服務
effectively
之外
enhance
咧，
our
其實咧，醫管局
mental
亦
health
都係
services
對
for
就住
children
而
and
家我哋喺兒童
adolescents.
科嘅即係尤其是兒童嘅精神健康嘅服務嗰方面咧，點樣
And
可以
the
加快，
HA
例如咧，令到
will
佢
see
個輪候時
how
間咧
we
係短啲。咁所以
can
咧係
shorten
亦
the
都會
waiting
加入咧
time
係用兒科醫
for
生
mental
去
health
協助處理一啲
services,
尤其是
and
係專注
they
力不足同埋
may
咧係過度活
engage
躍症
allied
呢個
health
個案咧，希望咧
professionals
加
and
入兒科醫
pediatricians
生，即係唔
to
係話
assist
淨係
in
精神科醫
handling
生啦，加
of
入兒科醫
attention
生咧係可
deficit
以加快去處理。
hyperactivity
咁亦都
disorder
係對
cases. The Department of Health plans to start an ongoing mental health promotion and public education initiative in the coming 6 months to raise the community's understanding of mental diseases so that we can build a mental health-friendly society in the long run. So I have briefed you on our measures and policies, and of course we need manpower to carry them out. We have a shortage of doctors, nurses, and airline professionals. For doctors in particular, we have increased the number of training places for doctors and nurses in our universities, but we need a multi-pronged approach to enhance manpower. Without compromising the training opportunities for locally trained doctors, we have to explore ways to attract overseas trained doctors to come back to work in our local healthcare system. Now, for the period of limited registration, it has been amended from 1 year to 3 years under the Medical Practitioners Ordinance. Now, for those who have got an interim specialist training overseas, we will see how they can receive specialist training in Hong Kong. We are now discussing with the Academy of Medicine, and it has indicated the support, and we're discussing the way forward with the Academy. It is important that we continue to monitor the manpower needs, and we have just started a new round of manpower projection exercise, and the results are expected to be announced in 2020. Now, for the nursing profession development, the Nursing Council is doing a lot of work. In early 2020, it is going to launch a voluntary registration scheme for the development of nursing specialties. We will set up a statutory registration scheme for nursing specialties sooner or later. And the voluntary scheme will lay the foundation for the statutory scheme. Now I turn to agriculture, fisheries, food safety, and environmental hygiene. If we want Hong Kong to be a livable place, environmental hygiene and food safety are important livelihood issues. I want to cover 4 areas very quickly. First, public markets. We have FEHD-run markets, and you may recall that we have a market modernization program funded by the government at the expense of $200 million. We don't want our public markets to be just places for shopping groceries. They should be important landmarks. They should be places for people to meet and to shop for their daily groceries and food.
新街市或者係新街市嘅需求咧，亦都係有響度。咁所以咧，我哋
There is a demand for new markets.
覺得某一啲區咧，其實我哋係需要新街市。
You may think that we need those in certain districts, but the lead time for building a new market from siting, from achieving consensus of district councils and building them, that takes a long time. So we are going to adopt a new model to launch the operation of a public market. And this will be in Tin Shui Wai. We have already announced the siting. Of course, we are planning a new market also in Kutong North, new development area. And in a short while, we are going to complete the site selection for a new market in Cheung Kwan O. We'll be consulting the district council. As the name suggests, this is a modernization scheme for all markets. We're also talking about modernized management. We have started our work in Aberdeen, and we are planning to do more in other markets. And we are also taking forward minor works programs without waiting for larger scale rebuilding. Environment hygiene. This is a huge public concern. And we are really talking about anti-rodent, anti-mosquito, and cleaning work. Of course, we are also concerned about the cleanliness in public toilets. We have been effective in carrying out anti-mosquito work. We are seeing monthly OV trap indices drop, and we have no local dengue fever case this year. We are going to adopt IntoCare, which is a new mosquito trap, and we will also improve the design of the OV traps. We have made interdepartmental effort in tackling rodents. I'd like to mention here that we are going to have trial use of night vision and thermal cameras. This is to help us assess the effectiveness of our anti-rodent work. We have been also working on the front of managing the cleanliness of public toilets. Now, food safety. I'd like to mention the strengthening of regulation on harmful substances in food. This is an international trend. We are going to consult the public on proposals to strengthen the regulatory regime, and we are going to concentrate on two substances: one, industrially produced trans fat; two, mycotoxins. And now, fisheries and agriculture. Our policy is also to promote the sustainability of the industry. We will designate new fish culture zones and issue new marine fish culture licenses. We will be expanding the possibility of development of mariculture. We are researching into new directions for development. We are also going to help existing fishermen to switch to sustainable modes of operation. And then agriculture. We'll continue our work in the establishment of an agricultural park. With financial support from LegCo, we can take the project forward. Of course, we need to support financially sustainable development. We started two funds last year, one for agriculture, one for fisheries, and we are continuing to receive applications for these two funds. And approvals have been given, and we have heard that we should deregularize our procedures so that the funds can help fishermen and farmers to transform their businesses or switch to other modes of operation. That's all from me. Thank you very much. I'm very happy to take questions. Thank you for the briefing on livelihood-related issues. Questions are welcome. Now TV, I'm Chu. Dr. Law, I'd like to ask about review of CSSA. Some community living supplements